mentioned, my name is Jesse Ketterman. I'm with the University of Maryland Extension, and today is part 2 of our farm succession planning workshop. I'll be joined by my colleague who will introduce herself shortly. Today we're going to focus on health insurance in your senior years, Medicare, and other options. So we're going to talk about that health insurance side of retirement and succession planning as our session this evening. And this is part of our initiative we have within University of Maryland, our Health Insurance Literacy Initiative. This is a program that we run through that, and we're glad that you could join us tonight. So this is a collaborative effort between University of Maryland Extension and University of Delaware Cooperative Extension. There's a team that's working with us with this project, but tonight your speakers will be myself and Maria Pipitis, and I'll let Maria introduce herself.
So good evening, my name's Maria, and I work with the University of Delaware Cooperative Extension. I'm an extension educator in family and consumer sciences with a specialty in financial management and health insurance literacy. I'm an accredited financial counselor and financial coach. Glad to be with you today.
And thank you, Maria. And a little more about myself. Again, I'm with the University of Maryland Extension. I'm a family and consumer science educator in the Western Cluster of Maryland, and I also am an accredited financial counselor. So as I mentioned earlier, this is session 2. Last week, we introduced some topics around retirement planning. If you weren't able to see that session, it is available online, and we'll send that information out to you to make sure that if you wanted to catch that session and weren't able to do so. Tonight, we're going to talk about health insurance in your later years. Next week, we'll talk about business planning and communications, and our 4th session will be on legal topics, planning tools, and finding the right team. And all of these sessions will be on Thursday evening from 6 to 7:30, so you're welcome to join any of those sessions. So last week, we introduced this diagram and talked about how, estate planning, retirement planning, business planning, and succession planning all overlap, and there are things that support succession planning and a lot of documents and things to consider. And so, this diagram does a nice job. As some people want to try to look at these things as separate entities, but really there's an overlap with what we do. And last week, we focused on introducing that topic of retirement planning and the things you need to consider there and steps to do that. And this week, again, we're going to focus on that concept of health and other insurances. So again, when you talk about the keys to success, it's important that you have a plan, that you communicate it, that you're transparent, and then when you need support, you're finding the right advisors. And so those are keys to success here. And as you go through our sessions, you're going to get all the information you need to work on your succession plan. So our plan for today, we want you to understand what you need to know about healthcare costs in your senior years. We want you to know where to go for information about Medicare and supplemental health insurance options. We're going to review strategies and use tools to help estimate healthcare costs. In fact, we have a case study. If you looked at the materials in advance, we sent a couple materials to you. And if you have access to them, that's great. If not, we're going to be talking through them in the slides. So, but they are available to you. And we're going to identify what options there are within these plans to cover long-term healthcare costs. So before we get started today, we have a survey for you. So we're going to copy this link and put it in the chat room. Maria, if you could do that for me, I'd appreciate it. It's go.umd.edu/seniors eval. And this is how we get feedback about this program. If you complete the first page at the bottom, it'll tell you to stop and just minimize that window, because we'll come back to it again at the end of the program to complete the second page of the survey. So this is an IRB approved survey, so you know you're not required to take it, but we do appreciate if you could do that, because we are looking for feedback about the program, and by all means, there's no harm that will come to you as a result of completing the survey. And I think we put the consent form also in that drive that was shared in the chat box. So once you've had an opportunity to complete the survey, if you could just put a note in the chat box and let me know that you're ready to go, that would be helpful. Again, all you need to do is complete that first page at the bottom. You'll see a big stop sign, and it's pretty much just going to ask you just to minimize the screen so that we can come back to that later on. So for now, I'm going to wait and give everyone an opportunity to let me know in the chat box they're ready to continue with the program. And Maria, thank you for posting that in the chat, the link there for everyone. I'll give everyone another minute, and then I'll get started with the next slide. Looks like we have one person finished. Thank you. See another one, thank you. There are 3 other members of our team joining us tonight that are providing some support behind the scenes, and I want to thank them. We have Paul joining us, and Lori and Meha, and if you join sessions 3 and 4, you'll get to know them, because they're going to be the presenters for sessions 3 and 4. Okay, so it looks like we're ready to move forward. And what we want to do is start with what questions we're going to answer as we go through tonight. And so we want to look at the question of why, and you know, why do I need to plan for healthcare after the age of 65? We're going to look at some what questions. So what is Medicare and what does it cover? And what are my other insurance options, and what documents provide that information? And then we're also going to look at the how. And the how being, how do I estimate my healthcare cost, and how do I cover long-term care? And when I do that, I can become a smart user of my health insurance. So now we're going to turn to that first question of why, and why do I need to plan for healthcare after the age of 65? And if we could get a couple responses in the chat, that would be helpful. Why do you think you need to plan for healthcare after the age of 65? Let's see what answers we can get in the chat box from that. Why do I need to plan for healthcare after the age of 65? We'll get a couple of responses, and then we'll move on. Because your income will be reduced, right? So you want to have a plan if your income is going to change. Medicare only covers a portion of your health care. That's a good answer as well. Healthcare costs can increase, absolutely. People are in retirement and don't have an employer-based health insurance program. So, right, you got to transition to a different type of health insurance. All of those are good answers, and I'm going to turn to some of the reasons that we have. One is to ensure the coverage that you need as you age. So when you turn 65, you need to make decisions about health care. And for many people, Medicare becomes your primary insurance. And what you have is a 7-month window to sign up. And if you're if you're offered insurance through your employer, it usually becomes secondary or your supplemental policy. So in addition, as we age, we tend to need access to additional health care. So it is not only required, but is also to your benefit, you know, to make sure that you understand your health insurance options. You want to gain the most benefit from your insurance coverage. So having insurance ensures that you have health benefits and access to preventative services like your annual checkup, because insurance providers have negotiated rates with healthcare service providers. You're often likely to pay less when you have insurance than if you had to pay the provider directly. To help determine your out-of-pocket cost of your healthcare plan, we know that healthcare costs are a major portion of individual and family spending plans, so understanding them is very important as you work on being financially prepared and staying healthy as you age. And so by building savings for healthcare costs into your spending plan, you'll reduce your reliance on credit to cover expenses, and you'll increase your confidence and capability to cover these costs. And so if you used a tax advantage saving tool like a health savings account, you also have a better understanding of how much you will use what you've saved to cover those costs. So it's, you know, it's important to have an accurate guide to the dollar amount to set aside and what you'll be spending so that you can access your health care when you need it. So to have money to pay for out-of-pocket costs, as we said, healthcare costs are a major portion of a individual family spending plan. So even when you retire, you still have out-of-pocket costs associated with your Medicare coverage. So out-of-pocket expenses are expenses that you have for medical care that aren't reimbursed by insurance. And some of those out-of-pocket costs would include deductibles, co-insurance, and co-payments for covered services. And you'll want to determine if you chose the right plan. And so, you know, Medicare, prescription drug, and supplemental Medicare policies can be confusing, but if you estimate costs associated with your plans, you can make better decisions when you select your plans and use your plans. So making sure that you have the right plan is also very important. And so for all these reasons, understanding and reviewing costs are important steps to being a smart user of your health insurance. So now we're going to turn to the what question. So what is Medicare and what does it cover? And Medicare is our national health insurance program in the United States. It began in 1966 under the Social Security Administration and is now administered by the Centers for Medicare and Medicaid Services. And it provides health insurance for Americans age 65 and older and younger people with some disability status as determined by the Social Security Administration. People qualify for Medicare coverage, and Medicare Part A premiums are entirely waived if the following circumstances apply. If you're 65 or older and you're a U.S. citizen or have been a permanent legal resident for 5 continuous years, or they or their spouse has paid Medicare taxes for at least 10 years, or if you're under age 65, disabled, and have received either Social Security SSDI benefits or Railroad Retirement Board disability benefits. So you must have received one of these benefits for at least 24 months from the date of entitlement before becoming eligible to enroll in Medicare. And the other scenario is if you're getting continuing dialysis for end of stage renal disease or kidney transplant. So those are all reasons. So enrollment for at least Part A must occur during or 3 months before or 3 months after you turn 65 during this 7-month period. So when you include the month that you're born, that makes 7 months. There will be no penalties issued. And then signing up for Medicare Part B can occur from January to March of each year. And what Medicare does is helps reduce the cost for seniors, but there are still costs associated with the program. So we're going to take a closer look at that. So what does Medicare cover? there are 4 parts to Medicare. We have Part A, Part B, Part C, and Part D. And so Part A covers the hospital coverage. So that's the inpatient hospital coverage component. And that covers things like inpatient hospital stays, home health care, and skilled nursing facility care. You have Part B, which is your medical coverage. And it covers things like doctor's visits, outpatient services, and diagnostic screenings. You have Part C, which is also known as Medicare Advantage. And Medicare Advantage plans are offered through private health insurance companies. So when you join Medicare Advantage plan, you still have Medicare. The difference there is that the plan covers and pays for your services instead of the original Medicare. So it's kind of like the option other than Medicare. These plans are required to provide the same coverage as original Medicare, and you can also have extra benefits like vision and dental depending on the plan. And you know, the options for Part C will vary depending upon where you live. And then, you know, in some cases you may only have one option in a rural community. So you do want to look at those options and see what's available in your area when you're starting to make that decision. And then Part D. Part D is the prescription drug coverage, and Part D is only offered through private health plans. So we're going to play a video to take a closer look here. So give me a minute to switch screens and make sure I have the settings correct.
Hi, I'm Angela James at the Centers for Medicare and Medicaid Services. Did you know that you can choose how you get your Medicare coverage? Today we're going to talk about the differences between original Medicare, Medicare Advantage and prescription drug plans, and Medicare Supplement insurance policies, which are also known as medigap policies. When you're eligible for Medicare, the first thing to consider is whether you want to get your coverage through original Medicare or a Medicare Advantage plan like an HMO or a PPO. Both original Medicare and Medicare Advantage plans have both Part A and Part B coverage. Part A covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. Part A is free for most people. Now, Part B covers certain doctor services, outpatient care, medical supplies, and preventive services. There's a monthly premium for Part B. Now, even though both original Medicare and Medicare Advantage plans cover Part A and Part B services, there are some differences that I want to help you understand. Original Medicare is provided directly through Medicare, and you have your choice of doctors, hospitals, and other providers that accept Medicare. Original Medicare covers about 80% of your healthcare costs. Generally, you or any supplemental coverage that you have pays deductibles and coinsurance, and you usually pay a monthly Part B premium. Now, Medicare Advantage plans, also called Part C, provide coverage through private insurance companies that are approved by Medicare. In most plans, you need to use doctors, hospitals, and other providers that are in your plan's provider network. If you decide to use a provider outside of your plan's provider network, you may have to pay more or pay all of the costs. And there are usually co-payments or co-insurance for covered services. And you may pay a monthly premium in addition to your Part B premium. Now, each plan has different costs and rules, and some can have extra coverage like vision or dental. Now I want to tell you about Medicare prescription drug plans, also called Part D. These are plans that add drug coverage to Medicare. These plans are run by private insurance companies that are approved by Medicare. To add this coverage, you usually pay a monthly premium. If you have a Medicare Advantage plan that offers drug coverage, you may have to get that drug coverage through your Medicare Advantage plan. Otherwise, you can join a Medicare prescription drug plan. So do you remember how I told you that Medicare pays about 80% of your healthcare costs? Well, Medicare Supplemental insurance policies, or medigap, is coverage that's offered through private companies to fill in the gaps in original Medicare. With a medigap plan, you pay a monthly premium in addition to your Part B premium, and the cost for that premium can vary between policies and companies. You may also be able to get similar coverage through an employer or a union. It's important that you realize medigap policies don't work with Medicare Advantage plans. In fact, if you already have a Medicare Advantage plan, it's illegal for someone to sell you a medigap policy. Now, these are just the basics. To get more information about your Medicare choices, visit Medicare.gov, and you can also check out some of our other videos on this YouTube channel to learn more.
So that video was a good explanation. I do want to take a minute to pause to see if anybody has any questions about the different parts, Part A, Part B, Part C, and D, and if there are any questions that pop up here, Maria and I will answer them for you. And then we'll start to explain a little bit about the cost. So I just want to make sure everybody understands Part A, Part B, Part C, and Part D. So we'll see as people, might have a question. You go ahead and type it in, and I'll start to explain this, and we'll come back to it if we see something pop up in the chat room. And Maria, you can help me if something pops up there in the chat room. So you have Part A, and as you can see here on the screen, this is part of the materials that's in that folder that Meha shared with you, and you have access to. It was at the beginning of the chat here. These are the 2020 costs at a glance. So you have Medicare Premium Part A, and most people don't pay a monthly premium for Part A. And so as long as you paid your Medicare taxes for at least 30 quarters, as long as you contributed to Part A monthly premium, typically this is free. Now, if you buy Part A, you have to pay, you can see up to $485 a month in 2020. If you paid Medicare taxes for less than 30 quarters, then, the standard Part A premium is $458. If you paid Medicare taxes for 30 to 49, the standard premium is $252. So you have to have more than 40 quarters there. And again, this is the free part. Now, there are some costs that you need to be aware of. So you see the second box there, Part A, hospital, inpatient, deductible, and coinsurance. There's a $1,400 deductible for each benefit period. So that's different than what you may have with your current insurance. Your current insurance, you may have a deductible that you pay for a year. With Medicare Part A, you have a deductible for each benefit period. So if you went in the hospital for something, that would start a period until you got out of the hospital for that particular issue, okay? So that's a benefit period. And then you can see days 1 through 60 while you're in the hospital, there's zero coinsurance. Days 61 through 90, there's a $352 coinsurance per day. And then it continues to go up from there. So with Premium Part B, there is a monthly payment. That monthly payment's $144.60 or higher, depending upon your income. And this is for each individual. So this may also be a change from what you're used to. Typically, if you have a family policy, it's just you're making one payment for the entire family. But once you hit 65 and go on Medicare, if you're paying for Premium Part B, you would pay that for each individual that's on Premium Part B. And so you can see there's a deductible, $198 deductible. So after your deductible is met, what you typically pay is 20% of the Medicare approved amount for most doctors. And that's the way that works. Part C, your premiums are going to vary depending upon what type of plan you select. So we really can't give you an idea of cost there. That's going to depend upon the plan that you would choose. And the same with Part D, which is the prescription plan. So if you purchase a prescription plan, that's going to vary depending upon the plan you select. So important dates to know. So there are 3 times that you can sign up for Medicare. You have the initial enrollment period, a special enrollment period and a general enrollment period. You know, and if you have one of those specific questions, there's a what we call a state health insurance assistance program, a SHIP program. And if you type SHIP health insurance in Maryland, they would, you know, you'd come to a website and you could find a local provider for your county that can answer questions there. But for most people, you sign up for Medicare 3 months before, the month of, or 3 months after you're 65, after you turn 65. That would be your initial enrollment period. And then after that initial enrollment period, you'll start to receive information on October 1st, which that's when the updates are available for the next year on the Medicare website. And so that's when you can start to compare plans if you needed to make a change in your plans. And then October 15th to December 7th is when you could make changes to your Medicare prescription drug coverage. And then that new coverage will begin on January 1st. Okay. So looking at the question, what is Medicare Part C or Medicare Advantage plans? Basically, they're health insurance plans. They're like HMOs or PPOs. They include all the benefits and services covered under Part A and Part B. So that's one of their requirements. If they're going to offer a Medicare Advantage plan, it's got to meet at least at a minimum, the coverage of Part A and Part B. In some cases, it usually includes prescription drug coverage, which is also known as Part D. And they are ran by a Medicare approved private insurance company that follow rules that are set out by Medicare. And plans have a yearly limit on your out-of-pocket costs for medical services. And it may include extra benefits or services that aren't necessarily covered in original Medicare. And that it can be, in some cases, what makes it attractive for individuals to sign up for Medicare Part C. And so we're going to take a closer look at that when we start to look at what are my other insurance options. So we're going to jump into other insurance options because Medicare doesn't necessarily cover everything, right? You have deductibles and 20% coinsurance. So a lot of people will decide to have a supplemental or a medigap plan. And so medigap plan kind of supplements your Part A and Part B there. And, you know, it depends. There's a variety of sources where you can get that, but you can go to the Medicare website where they would have a listing of available policies in your county and state. And so that would be medicare.gov. And you also need to remember that Medicare does not cover long-term care. So long-term care insurance may be something that you need to consider. And we're going to talk a little bit about that later on. And so when you talk about what do Medigap supplemental policies cover, basically they're designed to wrap around the original Medicare plans. It depends on the type of plan and standardized plan offerings that help you compare and shop across insurers. And it depends upon the type of insurance plan. And again, it depends upon the insurance company. So when you look at these Medigap plans, they actually are labeled by letter. So this is in the information that you received in the folder. And this is a comparison of the different Medigap plans. So you see on the top there, A, B, C, D, F, G, K, L, M, and N. And then on the left-hand side, it talks about the services that are covered. So Part A coinsurance, you can see in the top there, Part A coinsurance and hospital cost up to an additional 365 days after Medicare benefits are used up. You can see each of those plans cover that. Part B coinsurance and copayment, again, depending upon which plan. Some of them do, some of them cover 50%, some of them cover 75%. You can see there Part A hospice care. One of the things I like to point out to people when they start comparing these plans is there's a label down there called foreign travel. It's right at the bottom of the screen. And you'll see some of them cover foreign travel, some of them don't. And so, you know, if you're someone that's thinking about traveling a lot, you may want to get a medigap plan that's going to cover your travel. So you need to kind of look at your individual situation there and figure out which of these plans would fit best for your situation. Now, depending upon where you live, you don't necessarily have access to all of these options. You will have options to A and C, and you would have access to F if you had already previously enrolled prior to 2019. So F is no longer available, but if you were enrolled in F, you could continue with that. But you can see there that when you talk about covering that extra cost that comes along with your health insurance, you know, there's an advantage to having a medigap plan if you're going with Part A and Part B. So at this point, I'm going to turn it over to Maria, and Maria, I think that you're up and you are available now.
Thank you, Jesse. So I just want to invite people to ask questions. This chart can be very confusing or a little overwhelming. It oftentimes makes me cross-eyed. But one of the things I have found pretty interesting, if you go to the Medicare.gov website, it allows you to put in your zip code. And once you put in your zip code, it will then also ask you, and what are you looking for? Meaning, are you looking for a Part D drug coverage plan? Are you looking for a medigap or a supplemental plan? Or are you looking for both? Or are you looking for a Medicare Advantage plan? And you can kind of say, I'm looking for this and this and this. And then it does the sorting for you. You click submit. And then what will come up is the list of available plans. And by available plans, I mean two things. One is the health insurance provider that is offering the plan. And then the second is whether it's an A, B, C, D, F, G, K, L, M, or N plan. And so if you know, for example, that you are looking for a G plan, you can actually just sort by that as well. And so just the plans offered by the variety of health insurance providers who offer the G plan, for example, will be shown to you, and then you can really compare the costs and the coverage across those health insurance providers. So I have to say, as a consumer educator, this website and this search tool is pretty darn good. So I don't see any questions in the chat. I was trying to give you a chance to throw questions at us. So I'm going to move on here and go to the next slide, which is really about, you know, okay, so what documents provide information that can help me make a good choice about, you know, what I might need in terms of health insurance coverage and or, you know, what plans might be good for me, right? So certainly some of the information that you need that can be found is on the Medicare insurance card, which there is a sample on the left, and or the Medicare supplemental plan or drug coverage plan that you may pick or choose, right? So there's important information that can help you better understand what your costs might be. So if you look on your supplemental plan insurance card, you'll be able to see what your copays might be, what your prescription copay may be, if that's included, those sorts of things. On your Medicare plan, it's not going to give you much cost information. So it's really an opportunity to kind of gather that cost information so that you can comparison shop and decide and or estimate what your out-of-pocket healthcare costs might be. Another important place to get information is actually the Medicare.gov website. That will provide information about the costs, or at least the amount of the co-insurance that you may have to pay for things. And then the other would be what would be called the evidence of coverage. And that is that document that comes along with that supplemental plan that helps you understand what deductible might be, what the co-insurance might be, those kinds of things. So the next question is the how, right? How do I estimate healthcare costs? And this is really important from the perspective of trying to figure out, well, how much do I need to set aside, right? So if I'm younger and I'm working towards putting money aside for when I retire, if I'm thinking about what kinds of assets do I need in order to help cover healthcare costs, this is an important estimation that can really begin to put some firm information into your decision-making process around estate planning and succession planning. Some recent research, 2017 research, really said that many people put off succession planning because they think they're going to need their farm assets to help cover for healthcare costs as they retire and as they age, which may be true, but by kind of getting a better understanding of what costs may be, you can make clearer decisions about how to set up your estate, how to set up your succession plan in order to really help cover those costs as you age. So getting a good sense of what the costs are can help alleviate some of those fears and also help you plan. So what we thought we would do is kind of make it very concrete by providing a case study. And so one of the items that was provided to you in that folder, in the Google Drive folder, is the Terry's family case study. And so I am going to kind of quickly go through this. And what this case study helps to do is kind of outline a little bit about how the Medicare and the supplemental plan work together, but it also is, we designed it as a tool to help you fill out some really important worksheets. So it's sort of a practice guide, I'll just say, for some worksheets that are part of that case study so that you can begin to do it at home, right? So here we have Terry and Drew, 68 and 67. They're a couple on the go, relatively healthy. They both have Medicare, a prescription drug plan, and a supplemental medical medigap plan. And after reviewing those healthcare expenses and explanation of benefit documents from last year, Terry noticed that there's an individual deductible for Part A of about $1,340, and for Part B, $366, and that's per person. And so multiply that by 2 people, right? Terry and Drew, you get a deductible of $3,412. So because the Medicare supplemental F policy, the only additional out-of-pocket costs will be for co-payments for their medical costs. So here are some of the ways they use healthcare, right? Each of them go to the primary care physician at least 4 times a year, one of them for an annual checkup, and they pay a $20 copay to see that doctor. Drew has allergies, visits the allergy specialist once a year, has prescription drugs to help manage that, and pays for $30 for an office visit once a year and $15 for prescriptions 4 times a year. Terry and Drew wear glasses and go to the optometrist once a year for a checkup, and each get new glasses, and the vision copayment is $30. and the glasses cost $300 each. Terry and Drew each go to the dentist once a year, and that copay is $30. So Terry, let's look at the costs, right? Terry is paying $268 a month for Medicare Part B premiums, and $70, that's 35 times 2 per month for prescription drug coverage. And lastly, pays $380, that's 2 times 160 for Medicare Supplemental type F policy. So Terry also pays $80 a month for dental insurance for both of them. So they have a little an emergency fund, and they put some money aside to cover some of the deductible. But Terry wants to kind of get us a handle on how much they might be needing to put away to save, and or to, you know, what they might need to pull out of retirement funds in order to help cover costs. So one of the things that we provided in this case study is a worksheet that begins to help organize all of this, right? So what are those fixed healthcare costs? Those are typically the premiums. What might be some of the deductible or other fixed costs? And then you'll see on the second half of the sheet are some of the flexible healthcare costs. And so those are the things that have to do with copays and how many times they visit the doctor, etc. So we fill this in for you. And so this is an example, taking the information from our story and plugging it in here, right, in terms of the premiums. And so you begin to put together then their total annual fixed healthcare costs are almost $9,600, right, per year. And so that's including what gets deducted for the Medicare premium Part B. Then you begin to add in the number of visits and the copays, and that adds up to about $970 in terms of flexible healthcare expenses. So you can see it's beginning to add up a little bit. All right, so the other part of our case study tries to get you to answer 2 different questions. In what we call box A, how much do I need to set aside monthly over and above what I'm paying for premiums in order to help cover healthcare costs? This is a great way to begin to estimate, well, how much do I need to be having in savings and or be earning so that I can help cover those healthcare costs? And then box B, or sorry, box 3 has to do with, well, what are my total annual healthcare costs? And you see there's little color coded, right? It's color coded in here. And if you go to the previous page, those elements are color coded as well. But then when you begin to fill it in, this is what you get to see, right? So because they have a supplemental plan that is an F plan, their deductibles are covered. So their annual deductibles are actually 0. But then they have some of these other flexible healthcare costs, and we came up with $970. You divide that by 12, and you get $81 a month. So $81 a month is what they need to be, well, what they may be spending over and above what they're paying for premium. And so then down below here, you begin to see, well, what are the total annual costs? So they're basically paying $9,576 in premiums, right? Whether it's the Medicare Part B premium, their dental premium, their vision and supplemental plan, plus their flexible expenses or their total annual known costs, and add that together, and it's about $10,000, $10,546 is what they're paying per year. So that seems like a lot, but on the other hand, it's oftentimes a lot less than what we'd be paying out there on the open marketplace. So that's an example of how you can begin to estimate what those costs may be and what are the pieces that can kind of be put together to help cover healthcare costs in your senior years. So a few things that are really important to do in order to really manage those healthcare costs are things like reviewing those health insurance documents. Be sure that so that you really understand them and plan for them. And estimate those co-payments and prescription, any type of equipment, travel, other costs that might be associated with healthcare. Trying to put dollars around them can really help. Trying to figure out how much to set aside over and above those premiums can also be helpful in terms of really trying to manage the cost. And then the other piece is really about shopping around, right? Shopping around for the plans and making sure that they're covering what you need to cover based on your healthcare needs. And also, you know, kind of comparing from year to year to make sure that those plans are still covering what you need from year to year. Okay, so now I want to transition to this question of how do I cover long-term care? This often tends to be a very concerning question, right? What happens to me if something happens? What happens if I get Alzheimer's? Those kinds of things. And so first, it's sort of important to understand what long-term care is, right? Long-term care is basically a range of services and supports for one's own personal care. And typically it has to do with what are called activities of daily living, things that help you continue to live, like getting dressed, eating, using the restroom, remembering to take your medications, those kinds of things. And so long-term care is also called custodial care because it's really about helping you meet those daily living activities. And one of the things that's really important to know is that Medicare does not cover long-term care or custodial care. What Medicare does cover is care in a long-term care hospital. So if, for example, you get some sort of illness where you have to, where it's medically necessary for you to be in the hospital, that is something that Medicare would cover. It covers skilled nursing care in a nursing facility, right? It includes eligible home health care services. So if someone needs to come to the house in order for you to have medical care, it would cover that. And it covers some hospice and respite care. So oftentimes, Jesse and I get questions about, well, then what are my options, right? So certainly for when it comes to long-term care, and certainly some of that has to do with making sure that you have Medicare and medigap supplemental policies that are going to cover this skilled care that you need, right? That are going to cover the medical necessities. In terms of long-term care, that is helping cover the costs of assistance with activities of daily living, there are options out there called long-term care insurance. And these policies, you need to comparison shop, and they can be expensive, and they usually pay up to a certain amount each day. So for example, if it costs $500 a day to have someone come in and help with those activities of daily living, the policy may pay up to a certain amount of that, maybe all of it. It depends on the plan. So you really have to shop around. One of the things that we've discovered is that there's some life insurance policies that now have kind of built into them long-term care coverage. And so they're typically whole life or universal policies that have an addendum to the policy that allows you to withdraw money from that health insurance policy plan to help cover the costs of care. So, for example, if you have $200,000 saved up in that whole life policy, if the policy allows, you can begin to draw that money out to help cover the costs of care. What, of course, that does is lowers the balance that gets paid out to your beneficiaries. So it's something to look into if that's something that you're worried about. Clearly, lots of people try and use their assets, right? And then and selling their assets to help cover cost of care. And then lastly, listed here is the Medicaid and state programs. And all of those are for limited income seniors. So it is a matter of kind of reducing your assets in order to be enrolled and eligible for programs then that will cover all of your medical costs. So there's places like places on the web where you can find more information, and Jesse is going to tell you a little bit more about those things. Oops.
Well, thank you, Maria. And so, you know, there are a couple different sites you can find some more information about Medicare and supplemental plans. Of course, you know, Medicare.gov is a very good website, and that's got general information and in your account for specific. So you could log in and set up an account, and it will give you specific information. But Medicare.gov is a place that you can go. If you have a supplemental health insurance provider, you can go to their website or call their 800 number. If you have a Part D prescription plan, again, use their website or their 800 number. Earlier, I mentioned the senior health insurance program. It's called a SHIP program. There's the national directory. And again, you're also probably going to find one of those directories within your state. So I know Maryland has its own resource directly related to SHIP, but you could use that website, your local Medicaid office, and then there is a long-term care.gov site that you could go to. So all those places are reliable resources that you can use to gather more information about Medicare and the plans that go along with it. Now I want to take you back to your evaluation. So you should have minimized the window there at the beginning when you filled out your evaluation. If you could open that back up and click to the next screen, and there's a series of questions. We would appreciate it if you take a minute to answer those questions. So like I said, you know, go back to the screen you minimized there earlier, I think, you know, with the third or fourth slide from our presentation tonight. Bring that back up, click next, and that'll take you to what we call the post-survey questions. And if you could fill that out, we would appreciate that. And as you're doing that, I also want to invite you to ask any questions, and Maria and I will do our best to answer those questions for you. Maria shared in the chat box how you can kind of Google senior health insurance program and your state and/or county. Again, that'll pop up. I know Maryland kind of has a flyer that lists every county and the phone number to contact in that particular county. Depending upon your state's website, it may be set up a little different, but it's going to be something similar. You're going to be able to find that information. And that's one of the, that SHIP representative. I just recently had to sit down with my aunt and give her some guidance because she's getting ready to turn 65, and she is getting a boatload of information in the mail about all of these insurance policies. And she's like, Jesse, I don't know what to do. And I said, just set all that stuff to the side. First thing you want to do, go meet with your SHIP representative. Call them, and they will give you all the insight you need and help you kind of move in which direction you need to with your particular situation. So, but that definitely will happen. Once you get close to that 65, you're going to receive a lot of information and you have to sort through it. You know, you actually also receive a letter from Medicare saying, hey, it's about time for you to enroll. So that should also be a trigger for you to contact that SHIP representative. Yeah. So as you wrap up that first survey, again, we're giving you an opportunity to answer any questions. I'm going to advance to our next slide because we do have a second survey that we need you to complete. And this is the survey that goes along with our series that we're doing. And I'm sure that Meha is going to post this link into the chat box so that you can go to it and fill out that survey. And that is go.umd.edu/5NI. And again, between the two surveys, that first one you did is a pre and post survey just for that program because we're in a pilot testing stage with this particular program. This survey goes along with our succession planning. So each week we're asking questions as a post-program survey to the information you received that night. And we'll use that information to improve our program the next time we run this series. And Maria said, your feedback is so helpful. She just forgot to add a couple O's to that end of that there. And there is the contact information for Maria and myself. Again, Maria's with University of Delaware Cooperative Extension. I'm with University of Maryland Extension, and it doesn't matter what state you're from, we'd be happy to answer any questions that you may have about our program tonight. And it sounds like, and that wraps up our presentation for this evening. So if you don't have any questions, we do thank you for joining us and appreciate the time you've taken to complete our surveys. I know a lot of times we don't like to send out 2 surveys there at one time, but we're kind of evaluating 2 different aspects of our program tonight. So we appreciate your willingness to do so. And we look forward to seeing you next week with business planning and communications.